Welcome to
back
the podcast.
Welcome
to the Visceral Voice Podcast. Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everybody. Welcome back to the podcast. I am so thrilled to have you here for today's guest, Dr. Alice Lamb. Dr. Lamb graduated from the University of Texas Health Science Center at San Antonio School of Dentistry and has been practicing for 25 years. She owns a relationship-based practice that offers a whole health approach to dental care in the West Houston area. Through her love for creating beautiful smiles, she began working in the craniofacial pain and airway world and found her purpose. Her love of patient care and her own personal journey with TMD and chronic pain led her to more deeply explore human kinetics and interrelated oral issues. Today, she brings to her practice a team of masterful practitioners, movement specialists, Mike Cantrell and AIA Fellow James Anderson, AIA Fellow, and Megan Bollinger, AIA Fellow, and Tom Tardiff, AIA Fellow, and postural vision neuro-optometrist, Dr. Heidi Wise, all within this collaborative community and team to provide a total body approach to restoring the body's symmetry, balance, alternating function, and breathing patterns. Truly remarkable that such an incredible team comes together to collaborate in treatment. Dr. Lamb is also a passionate educator. For many years, she has been a visiting faculty for the world-renowned Pankey Institute in Key Biscayne, Florida, teaching occlusion, TMD, and team building, and she has also served on their board of advisors. She was also an adjunct professor at Boston University School of Dentistry, where she helped create summer externship programs for dental students. Dr. Lamb is also a leader in preserving independent private practices as she leads a Houston area administrator for SmileSource. She has led and presented to many dental groups, organizations, and study clubs around the country. She has professional membership in the Academy of General Dentistry, the American Academy of Oral Systemic Health, the ALF Synergy Academy for Craniofacial Development, American Academy of Orofacial Pain, and the American Academy of Dental Sleep Medicine. Most recently, together with her practice partners, Mike Cantrell and James Anderson, she co-founded Applied Integration Academy, a multidisciplinary organization which brings forth education for treatment collaboration in physical functional healthcare with movement specialists, dentists, optometrists, myofunctional therapists, and sleep doctors to provide a whole body solution to movement dysfunction, craniofacial pain, TMD, and airway problems. Dr. Alice Lamb, thank you so much for all of the incredible work that you have done. That is an exceptional bio, and thank you so much for joining me on the podcast today.
Thank you, Christine, for having me. I'm so excited.
Yeah. Absolutely, my pleasure. I would love to begin with your journey into becoming a dentist, and then how that transformed for you into being able to work with such a remarkable team and being able to provide collaborative care?
What do you want to know first?
Where
That's a
your
hard
journey into
question.
your journey into dentistry is where we'll begin.
Yeah. Well, it's been 25 years. And, just like anybody, when I came out of dentistry, I just really wanted to, do good work and be competent. But one thing that I knew early on in life was that building relationships were really important to me. And running rooms like what you typically see in a dental office, um, I knew that was not going to last for me for very long. And so I wanted to have a more boutique practice where I see one patient at a time. So I went to studying, just complex restorative care at that place that you had read about, the Pankey Institute. And there they really taught me how to have a more relationship-based practice. And I loved cosmetics. And this is something not too many people know about me, but I was an art major when I was in college. But being Asian, my of course, my parents said, we didn't escape Vietnam for you to come to America to be an artist. So
Mm,
I got a choice, either an engineer, a doctor, or an accountant, something like that. And so, but I loved art. And so when I found dentistry, I thought, I could still do what I love and be a doctor and care for people, which which is how I ended up in dentistry. And
mm,
so I carried that, and I really came out of dentistry wanting to do really great cosmetic work.
mhm,
And through doing cosmetic work, you realize, well, why do people need cosmetic work? Majority of them are just going to shave their teeth down because the teeth are, just because they want white teeth. Most people that want veneers or a new smile is because they've really broken it down. So then
mhm,
I dove into function, which is how I found the Pankey Institute, because we realized that teeth break down because there's a functional um, or a dysfunction that occurred that caused people to brux and grind and all of that. And
mhm,
so I wanted to make veneers that last, and I'm, just being of curiosity mindset, I've always asked why. Like if your teeth broke down, why? Yeah, you brux, but then why? Why did you brux and your sister not brux and you guys look the same? Or, so I always like diving into whys, which has gotten me in a lot of trouble because I go down all these rabbit holes from my whys. And I don't know, I know you've been there. Otherwise, you wouldn't be the visceral voice, right? So that's how I ended up, then I realized, my goodness, all these people with smile issues, there was a deeper underlying problem of health. And many times they would have TMD, headache,
mhm,
which stands for temporal mandibular dysfunction. And that's, headaches and, 85, the stats show that about 85 of all headaches is related to functional, functional issues in the bite. And teeth play a huge significant role in that. And
mhm,
so because of my love for art, I ended up finding cosmetic dentistry. Because of my love for doing good cosmetic work, I ended up in TMD. And then next thing I know, you know, loving TMD, I started seeing patients that I didn't just restore their smile, I was able to restore hope because their pain went away. And the smile was just, the cherry on top. They came for a smile thinking maybe if I have a good smile, I'll be able to tolerate my headaches and things will get better. But, many people didn't realize that in restoring a good smile, if you do it from a functional approach, you can actually restore headaches and neck aches and shoulder aches. But when I started getting these weird comments from patients said, Dr. Lamb, ever since you made me that splint and helped me with the headaches, or you restored my smile and everything feels good and straight, my knee pain went away. And I was like, yeah, I wish I could take credit for that, but I think it's a coincidence. Good on you, right? And but when you hear that the first time, you're like, I'm not going to pat myself in the back, but if you want me to give me credit, sure, I'll take it. But then when I hear it again and again, and if it's not knee, it's foot issues or hip issues or, you know, whatever the issue is, people people started saying things and it got me curious. Um, so that's kind of, I knew there was a body because everybody says, well, the whole body's connected, but nobody's ever said why and how it's connected.
Yeah, it leads us back to the why. Why
Yeah,
is your knee pain better?
yeah.
Why is your hip pain better?
And when I got really curious wasn't just my journey seeing patients, and then there was a journey for me being a TMD patient myself. Look, like I had issues because as a young child, my
Mm,
bite was off. I didn't have orthodontics till I was an adult, and and then I hurt my knee. I was a dancer, so I've always been very hypermobile, and so you can start seeing as the years go by and your body starts breaking down. You start putting two and two together, and when you're in
mhm,
the pain world, you start meeting people, which is how it all kind of started because I started having backache and knee issues and foot issues. And I thought, gosh, how much more am I going to last in dentistry? And then I would attribute it to, oh, it's my body posture during dentistry, which a lot of us attribute to that.
mhm,
And then there are a lot of people that do dentistry all day long, they don't have issues, you know? And in my journey in understanding the information, I ran into an amazing physical therapist, but he's not really a physical therapist. I think he functions in a little subspecialty, I would call it, in his physical therapy. He calls himself a recovering physical therapist, is Mike Cantrell. And he introduced me to his whole gang of friends, James Anderson, Megan Bollinger, Tom Tardiff, and then I met Heidi Wise, who's a neuro-optometrist, and I just thought, this is the first time I've ever gone out of my profession and meet people, and I can totally connect because we were all after the same thing, but with different perspectives about it. And so that's kind of how I found out about the work that I'm doing in a collaborative way, and it's been now, 25 years into this, weaving through the different parts of dentistry to get to where I'm at today, I feel like, gosh, I really went a bunch of rabbit holes, but now that all those rabbit holes, they're merging into this one lane, and we're calling it physical functional healthcare. And I think this lane that we're in, what I love about it is that it's collaborative, it's inclusive of health providers that all come together, and we're now finally speaking the same language. And we're not bouncing patients around saying, okay, I'm done with this part. Let me throw you to somebody else to deal with another part. Let me throw you to come back some. And, we're just ping ponging patients all over the place. And
mm,
who's responsible? Who's the quarterback? Nobody usually is. And if the patient, is intentional or understands science enough, they can be. But oftentimes it's so hard for patients to be their own advocate. And so with the center that we have now, bringing together all of these medical, professionals with different uh, expertise, and we're coming together, we're discovering things because we're under the same roof. We're
mhm,
discovering things that would not have been possible had we worked in our own silo. And so I feel
mhm,
really, really blessed to have been positioned that I'm at, and have had all the training that I've had that have culminated to this moment in time. And I think it's real special, and I feel like we all work with this purpose, thinking, gosh, we know we're meant for this path right now, and we're not going to waste it.
mhm.
So
It's
that's why when I
amazing how
met
much,
you and heard
yeah.
what you're doing with voice, it was mind blowing to me. And you came to learn from me. I want to learn from you. I'm so excited for us to, whenever we meet people that, like for you, you've been working in voice, and then you know quite a bit about the body, but you figured out where the connection was. And then you went
Mm,
out and found professionals who saw the connection, but didn't put it together and work the way you did. And
mhm,
I love that because I think the world needs that.
Yeah.
So,
Yeah, coming together and learning so much from one another. I'm a lifelong learner, and I think that's what life is about. And I just want to soak up as much information. My goal, I believe my whole existence in life is to help people find a freer voice, whether that is up on stage or whether that is more ease in being able to speak their authentic truth. And
yes.
my whole search has been on finding ways to help the community be able to do that. So it's been such a joy and honor to meet all of your collaborative team and be able to work with them and learn from them and bring it into and work with this demographic and see what happens. It's just been really inspiring. So thank you for all of the work that you do. And I'm going to just touch on two things that you mentioned. One, that you're an artist, which you're a performing artist as a dancer and an artist, a visual artist. And I knew it. I knew it.
You knew it. You
I
got it.
knew it. I was like, yes, because you're my person. You're one of my people. There's something about artists that
Yeah, but
just,
as far as voice, the only thing I've ever done was karaoke.
you know what? I hosted karaoke for years, and here,
Yeah.
even when I was singing professionally, I was hosting karaoke. And the reason I did it, and people would laugh at me. They're like, "Really? You're hosting karaoke?" And I'd be like, "Yes," and I loved it. It was one of my favorite jobs. And the reason I loved it is because it was a constant reminder of people getting up to sing in front of other people because they loved to do it. Not
Yeah.
because they were necessarily, some of them were phenomenal at it. And I'm like, how are you not on a Broadway stage right now? Some of them were really great, and some of them, technique wise and stuff, had never had a lesson in their lives, but it didn't matter because they were doing it because they loved it. And we need a reminder when we're in an elite profession, when we're an elite performer of singing. Sometimes we need that reminder of, oh, yeah, I do this because I love it. Something inside of me, that child
Yeah.
inside of me when I first began, loved this so much. I have to go back to remembering that I love this and that I'm doing this because I love it. And I think that's an important part. The second thing I want to mention is you said TMD, and obviously because you're a specialist of the airway and TMD, and I often will have someone come into my office having been diagnosed with TMJ, and I'll say, "Yes, you
Mhm.
have TMJ. You have two. You have
Yeah,
one on this
exactly.
side and one on this side."
Uh-huh. Uh-huh.
So I just always love it when I hear someone say TMD, and so that was really fun. Okay, so I want to just kind of come into generally talking about the airway and the jaw and body and cranium and the connections. So I'd love to explore the relationship between, we'll zip code in and narrow in a little bit and then bring it kind of broader. So first, kind of the airway with the jaw, with the cranium, and then we can kind of adventure into more global, into body. So how they all respond together, this airway, this mandible, this cranium, so sphenoid, temporal, etc.
Yeah, so you kind of want me to help you make the connection between the head and the body.
Yeah, we're gonna go here and then we're
Okay,
gonna go down.
let's
So
go
we'll
all the way
start
down.
a little more
We're
local
gonna
and
go
then we're gonna
from
go.
descending influences. So
Yes.
my world my world deals, what we do is we deal with sensory.
Mhm.
Okay. Our body needs senses to be able to exist, even to breathe and to move from point A to point B. What we don't realize is that a lot of the sensory comes from right here. And I had no idea after 25 years that I actually own the control box of the body and the voice box. For those
Mhm.
for the listeners who are interested in voice, I kind of own the control board and I didn't even know it. And
Mm.
so now that I know it, I can't unsee it, I can't unknow it, and I feel like I'm responsible for it, and I want to scream off on the top of the mountain so that my colleagues would know that they own that, because anything we do, whether intentional or willy-nilly, will affect a human being and the ability to move from point A to point B well, and the ability to breathe and sleep and function well, the quality of life. and unfortunately, most of the time, because the body is so adaptive, you're not going to see the difference right away, but it's down the line. And you're not going to be able to backtrack and say, hey, it's from that crown that I did, from that tooth that I had taken out, you know?
Yeah.
And so I'll start with the sensory, the control box. So the lips, the tongue, the cheeks, and the teeth are a huge part of that control of the sensory complex. How important? There's a thing in your brain called the cortex, which is the outer covering of the brain. So you have a motor cortex and a sensory cortex. The sensory is input, motor is output, right? Skeletal and all that. Well, did you know that the parts that I deal with every day is almost 50% of the sensory and the motor cortex? If that's the case, if you look up the homunculus, that's the motor cortex, you can see that, for example, on that, your thumb and your index finger will own more real estate than your pinky because you need more sensory here. And you have sensory on your teeth too. Um, People think, oh, well, you just chew with your teeth, and if you don't have teeth, you stick in an implant. You can have implant. You can also have dentures. Except what they don't know is that there's sensory embedded in the roots of the teeth that allows you to know the space around you and to know the ground below you. So that, and that sensory tells your brain whether you're safe to walk and move and which direction to lean in order to do that. Um, that it's the whole reason why you see, children when they're first born and they don't have teeth, they can't walk. But four-legged animals that are born and they can go on their fours, they can walk right away. Do you know that? It's really
Hmm.
cool. And then children
Fascinating.
and their molars is what helps them find their heels and to be able to rotate well. And so that's why children, you'll see them tippy-toeing a lot because they can't find their heels yet until their 6-year molars come in. And then as we get older, elderly adults that lose, especially if they lose their molars, they start losing balance, not because they're old. They just have lost an important sensory of their body. So the teeth are important in that, and you can actually steer somebody to find their right side or their left side. You can get their vocal folds to be more symmetric if you have a symmetrical bite. You change their bite, and you know, somebody with a good voice that's talented, they're always going to have it, right?
Hmm.
The question is, can they be even better, and how long they're going to last with it,
Hmm.
right? And so if you can optimize the machine and take care of the machine and know there's biomechanics in this machine, then you can really enhance the talent you already have in your vocal cords. Um, so from a teeth aspect, that's always been, I did not know. I did not know that, because, for example, in dentistry, when we do implants, we're told on molars to take it out of occlusion. That means don't make them touch because implants don't have the ability to move around the way teeth do. So you could break,
Hmm.
you could hurt the implants if you make them touch. Well, if they don't have sensation, then you lose sensation of body movement. You lose sensation of, you actually would lose sensation of control of your vocal cords.
Hmm.
You wouldn't have as much control. So that's why when you go through braces, sometimes, you may find that it's harder, not because of the brackets. It's just that you're putting so much pressure into the system that it can't figure out, that you may end up losing your capacity to adapt.
Hmm.
Um, so
And a
that's
lot of
one aspect.
sensory input at the same time with every
Yes,
single teeth,
every
every
single
single
teeth.
tooth being impacted, all of the teeth being impacted at the same time, the amount of sensory information that is sending to the brain all at once,
Yes,
that's a lot of sensory information throughout that time period.
yes. And the way they're aligned, and when your teeth go side to side when you're chewing,
Hmm.
actually affects that. And there's a reason why the average human will swallow about 2,000 times a day. Because when you swallow, the tops of your teeth are supposed to hit for a split second. That constant swallowing and hitting tells your brain where you're at in space and whether you're safe to be walking and existing where you're at. So that's the swallow. Which brings to the second most important, but actually it is the most important organ in the body, I believe, next to the heart, is the tongue.
I believe that
And I
too.
know that tongue is kind of where our worlds collide, right?
Hmm.
You're like, after talking to you, I know you're obsessed about that tongue, and I'm obsessed about the tongue too, and I love it. I love it when I talk to other people, and the questions you ask were such smart questions and such intriguing questions. I'm like, where is she coming from? I didn't know you were a voice expert. So when I figured that out, I was like, oh my gosh, I want to give you all this information because I want to see what you're going to make out of it, because I want the bits and pieces in the world that I work with the tongue. But, if we can collaborate on that, I can imagine what you can do to help the voice world when you get more information about the tongue.
Hmm.
But I'll start with the tongue by sharing with you that the tongue is so important that the development of the tongue in utero happens right after the heart's developed, the week after. And guess what? It is developed a few days before the heart beats for the first time. And so I'm not sure if the heart can beat if the tongue's not developed. There's no research to show that. But it makes me wonder, why does the tongue why is it developed days before the heart beats for the first time?
Hmm.
And as I dove into this work, I started to see, because that the importance of the tongue, now that I know what I know, I'm like, I know now why the tongue's developed before the heartbeat, because it is the it is the leader of regulating the central nervous system.
Hmm.
So it regulates the heartbeat. The
Yeah.
tongue is that important. Um, so I mean, we can come up with all kinds of questions now, in the singing world. I wonder how, you probably people who sing and do well, there's a reason why they live longer. I think first of all, they're happier people, right? Because singing makes you happy because all the endorphins that you get from that. But I think you also get you get to use your central nervous system in a rhythmic way, and there's a resonance that occurs in all of that. Um, and then I
Yeah, I
can
mean,
also
humming itself can
humming.
can encourage nitric oxide production, and so yeah, various.
Yeah, you told me that. I had no idea, but I used to, whenever I place appliances in that we do, like ALF, or we'll tell them is get used to your ALF, and it actually works a lot better if you sing and hum in them, and because it creates this vibration that allows the cranium to oscillate and move and dance. It goes into a rhythm, and I think the humming gives that resonance, right? It's for cranial movement, and cranial movement to me is everything to the rhythm of life.
Hmm.
So that tongue is just really important, and tongue function is really important. And we really, in the past, I think historically, medicine has only given the tongue credit for speaking. Like,
Hmm.
oh, speech impediment because of the tongue, then we'll do something about the tongue. Other than that, we're not going to do anything. But then now, I see people that have dysautonomia, where their sympathetic nervous system and their parasympathetic nervous system is not well regulated. And sure enough, if you look, you'll see a tongue dysfunction of some sort. Not necessarily a tongue tie. Um, to me, a tongue tie is different than a tongue restriction. But
Hmm.
a tongue restriction could be a functional restriction. A tongue tie is an anatomical restriction. Okay. And so, once I started diving into the work, I realized, oh, the position of the tongue in the mouth is kind of important. And
Yeah.
a lot of us don't know. We just think, well, the tongue looks like it's at the bottom of the mouth, so it should live at the bottom of the mouth. But did you know the tongue's supposed to live at the roof of the mouth in rest? And that means everything to your central nervous system. It means
Yeah.
everything to your breathing and your sense of well-being, that the tongue rests at the roof of the mouth.
Yeah.
Um,
I mean, it's how we nasal breathe. It's the foundation of giving our nasal, it's the nasal floor, as we had mentioned before. It's
A lot of
It's
people don't
remarkable.
even know that the tongue has anything to do with nasal breathing.
Hmm.
And how it's connected to nasal breathing is because the roof of the mouth, where the tongue resides, is the floor of the nasal sinus. And so when you swallow, your tongue, and when you rest, your tongue rests at the roof of the mouth. It's not, so don't go out there and just force it up and say, you know what, it's supposed to be up there and I'm going to get better airway. Let me just jam it up there. It doesn't work like that, you know? The tongue actually comes up. And even though it's one tongue, it actually has a rhythm between the left and the right. There's a right tongue and a left tongue. And it has this suction that in inspiration and expiration, there's a flow in that suction where it draws the roof of the nasal sinus down with left nostril, right nostril, because the tongue walks just like we walk. It's a bilateral body. And so in my world, we call that stomatic flow. And stomatic flow creates cranial rhythm, the rhythm of life. And so
Hmm.
when your tongue is lightly at the roof of your mouth and it draws down in inspiration, respiration, and in swallow, it descends the roof of the mouth to open up the nasal passageway, and then you're able to get air, filtered air through. When it filter air goes through the different pressure gradients, it opens up the ears, it creates airflow through, and it develops the air passageway. And so all of that, it happens just through you breathing and existing every day. The development is so important in the rhythm that you create. You don't even realize it, but it's an automatic system that that exists to preserve itself, develop itself, take care of itself, and all of that. And if it's not working properly, we see, all kinds of issues, maybe not right away, but definitely down the line, which is why we see people once patterns have set in. I would say, we're fanatic about patterns. We always look at patterns because through patterns, we see where the dysfunction may come from. Yeah.
Hmm.
Um, and you
I
mentioned about nitric oxide, right?
Yeah.
For me, for my world, I like nitric oxide because it's the most powerful anti-inflammatory your body could
Okay. Yeah.
use on its own. And in the nasal passageway, when you bring air through the nasal passageway, you have hair cells at the base of the nasal passageway, and just the air movement through it is what creates nitric oxide. It's amazing. And it
Hmm.
allows, like, good airflow allows for more airflow because things open up. And so it makes me wonder, you and I talked about it, when singers are constantly singing and they're breathing through their mouth, they're really
Hmm.
robbing themselves of some good nasal breathing that actually helps increase their capacity to sing. So
Yeah.
they work against the tides of the way the biomechanics of the body works.
Yeah, I
Uh,
always encourage someone that I'm working with that part of their warm up and part of their cool down should incorporate some nasal breathing. So we're
yes,
kind of warm because while they're on stage, most of what's happening when they're actually phonating is a lot of mouth breathing. And so if we
yeah,
can implement some nasal breathing as part of the warm up and as part of the cool down, then we can bring our nervous system and our brain back into that patterning where we'd be less likely to become patterned from
yes,
doing it so often on stage.
yes, yes, absolutely.
So I want
Um,
to, as we're talking about the tongue here, I want to get into a little discussion that we had previously, which is, I think, so important because those who have worked with me before know that I often recommend not pulling on the tongue. And it is a common practice in voice lessons to have someone stick their tongue out and pull on that tongue, sometimes while vocalizing, sometimes while not, and sometimes for a minute, and sometimes for 10 minutes. And so I would love, as we're discussing the tongue, to hear why pulling on the tongue might be very dysregulating and why that might not be such a great idea for our voice teachers to implement in the lesson.
Yeah, I heard that from you, and it just blows my mind. I thought, okay, we definitely are not doing a good job enough of getting the information out there, right? Because it makes sense to me why pulling out the tongue, and I went to look this up because I thought this is like I can't believe that. When you told me that, I was like, there's no way people will do that. And I'm mortified. Just being an airway, living in the airway world, I'm just mortified of somebody pulling their tongue out. Um, because that changes the way your diaphragm positions.
Mhm.
It changes your lower back. You have no idea, like pulling the tongue out does so much like systemically to the whole system. Um, the tongue is tied to the diaphragm. I don't know if anybody's aware of that, but a number of years ago, a group of doctors discovered that, wow, this tongue is really important because evidently the tongue, um, I would say about 2016, 2017, around there, people started noticing the tongue more, and then tons of research came out thanks to some work done by a place called the Breathe Institute with Dr.
Mhm.
Zaghi, who's like fanatic about tongues and getting protocols and understanding it enough. And so it kind of paved the pathway for everybody to contribute to that arena. And what we discovered was that so a group of doctors went in and started saying, well, now that we know what we know about the tongue and the development of the tongue and how important it is to the autonomic nervous system, wonder what the tongue's connected to, right? And so what they did was they dissected the tongue and they kept the fascia, which is the outer covering of the tongue. They kept it intact. And so if we were to keep this intact and we just teased it away and we dissected it, what all does it go to? And what they discovered, and you can look this up, and I can give you the resources so that you can have it for your viewers or your listeners. But what they discovered was the tongue is directly all connected to the diaphragm, to your psoas, down your gastrocs, all the way down to your toes. So we always say from
Mhm.
tongue to toes is actually there's a whole system. And so the tongue is part of a myofascial system connected to the diaphragm. So the diaphragm can be strained because the tongue is strained. And so pulling the tongue out is a big deal in the work that I do, because what we look for is, if you want the best breathing, the best airway, airflow, the tongue needs to be up at the roof of the mouth. because because when it's at the roof of the mouth, that means that your breathing can happen in the diaphragm. When you're pulling the tongue out, you're forcing the diaphragm to strain. Um, there's a phrase that we explain to patients when we have people that do all kinds of fancy stuff trying to gain airway, whether it be for sleep, in your case for singing. I always say, the neck would chase the face. Okay, so if you're pulling this out, yeah, you think you're opening the airway, but the neck's going to chase it. And the thing about the neck is, if you have a lordotic curve in your neck, that's when you have the most airway and airflow. If you have a straight neck, you lose it. How much? The studies, and this just came out last March, is that for every 5 degrees change in this lordotic curve, between straight neck and curved neck, you lose 25% of airway airflow every five
For every
degrees.
5 degrees, I'm going to just make sure listeners heard. For every 5 degrees, you lose 25% of your airway
Lose or
control.
gain up to, yeah, depending on what you're doing. If you're getting greater lordotic curve, you're going to gain up to
And
25% with every 5 degree. And this study came out with Dr. Kevin Koppelson and Sarush Zaghi from the Breathe Institute. They're studying airway, and they want to know, how important is neck position to the assessment of airway and airflow. And then when we took that a step further, rather than just looking at the head and neck, and I collaborated with my PT team, they're like, well, the best way And then I look and everybody's like getting these pillows to try and keep a curve in their neck, but when you're on stage singing, what are you going to do? Right? The best thing you can do is turn your glutes on, your hamstrings, and your obliques, because that's going to give you a curvature in your neck. And people are like, "What? Down there?" Yes, down there, because when you have a deep lumbar curve, it forces you into a straight neck posture. And deep lumbar curve comes from a lot of women. For example, it changes your center of gravity,
Hmm.
puts you at the balls of your feet rather than on your heels, right?
Yeah, so we're talking about everyone in heels. And guess what, everybody? We're talking about a rake stage for all of our performers who are performing on a rake stage. That is
Oh,
part of what can happen.
it will
And part of
change
why
your
we
air.
see more vocal, or not more, but we see a lot of vocal dysfunction or vocal injury when someone is on a rake stage. And then certainly when in a role like Nessa on Broadway, that is in Wicked, that's on a rake stage and having to hold into a wheelchair, and what that does throughout the pressure management, holding on a rake stage against that tip into a wheelchair.
Yeah. When you're on a hill, your body will go into a sympathetic response because it has to protect you. So you know that it's in a sympathetic response, you're going to end up with shallower breaths. And your tongue is going to stay low to activate the neck muscles in order to keep you upright and extended, in order to get you to go down that path. Does that make sense? So you're not going to be able
Yeah.
to expand your rib cage as much if you're needing more airway, or if you need more airflow. So what you'll do is you'll activate your neck, you'll brace your jaw, and you'll activate your tongue, because that allows you to activate your neck muscles. And activating your neck muscles so you can lift the rib cage vertically in order to breathe. And then by the time and when as soon as you activate these neck muscles, you're throwing yourself in a forward neck posture. Well, guess what? Throw yourself in neck posture, your tongue is going to be pulled back, because it doesn't come along with the jaw, it goes back. And so now you're going to have to reposition your tongue in order to get airflow, because you just lost, you just went from curved neck to straight neck, and you just lost airway back here. And so now your tongue's going to have to position differently. And so you may not be able to enunciate the way you would. Definitely, you won't be able. I can't see how anybody can belt in that.
In that position.
So
Yeah, I
anyway, that
love that you had brought up so when we're kind of bringing it down into the body, I want to go back onto two things that you said, because I think that they're so incredibly important. And when we go further down into the body, you had mentioned our glutes, and then the abdominal muscles, and how that really helps with what's happening with the respiratory diaphragm and the pelvic diaphragm. And if we don't have the stability below us, our brain, and we start to do something like a tongue pull, where our brain is trying to help give us some kind of stability or homeostasis, all of a sudden we're doing a tongue pull, but we haven't given anything underneath it. We haven't helped someone to actually learn how to set diaphragms up, how to actually activate some of the other musculature, the larger musculature of the glutes and the abdominals for really great respiratory function. We can really destabilize somebody.
I am like, every time I hear you and I watch you do that, it's mortifying to me, because we are so careful when somebody's tongue tied that we release just enough. We're so gentle to that tongue. And
Mm.
we want the tongue to do things with a feather touch, because the tongue works better with feather touch than force. Anytime the tongue has to force, whether it be bracing low to activate the neck muscles, anytime you do that, you completely activate your central nervous system to exist in a fight or flight mode. And that changes everything from, cognitive function to your ability to recruit, muscles to, I mean, just your, it, it's, it is mortifying
It's
to me.
scary.
Just
Yeah, it's scary. It's scary.
yeah,
And so really, what that person is probably needing is to help find some grounding below so they're not having to stabilize their bodies with their tongue, is what I would
yeah.
say.
In my world, we call with the tongue is part of something we call the mandibular diaphragm.
Yeah.
And so we have the
Mylohyoid, well, I'll teach it as the mylohyoid diaphragm or cranial mandibular hyoid diaphragm, buccal
yeah,
diaphragm. I don't know. I'll refer to any of
a
them.
lot of people have different names for it, but my understanding of it in learning this stuff is the tongue's part of the mandibular diaphragm. And then you have your thoracic diaphragm, and then you have your pelvic diaphragm, which is your pelvic floor.
Hmm.
And the three of them work together again in a rhythm,
Hmm.
set up by the cranium in a rhythm, because that allows you to breathe in a rhythm. And so when you're pulling that tongue, remember what I said when we dissected the tongue and we connected it to all the little parts. You literally are pulling that tongue and you're pulling somebody all the way down to their toes. You completely ungrounded them. And that is profound impact. Absolutely profound impact. You just change the way they breathe and the way they experience air and experience the ground. And you just put them into a fight or flight of danger. Their body is saying, I'm in danger every time you pull that tongue out.
Hmm.
Um, so much that, I was talking to my mom about this and sharing with her after I talked to you, and she goes, you know, in when your dad was in the military in Vietnam, that's one of the things they did to torture people. Do you know that?
I
They
did
pulled
not know that.
Yeah, so in the communist camp, that's one of the things they would have you stand up and they would have these clips and they pull your tongue out because they know that it would drive you crazy.
Yeah, it just
So
made me nauseous hearing it. That just made
it,
me actually
no, no, and when I heard
viscerally
that, I was like,
nauseous.
what? You know? That's one of the
Wow.
forms of torture is to pull somebody's tongue out because you could really hurt them. Um, and it's just profound and it diminishes the diaphragm's ability to inhale and exhale. And I
Mhm.
know that for singers, it's really important to be able to get, an effective inhalation so that when you exhale, you can exhale with your voice in power. But when you pull the tongue out, you just rob the mind's ability to resolve how whether the diaphragm can exhale fully. Because when you're pulling it, what it does diminishes that diaphragm and makes uh, when you inhale and the diaphragm's flat, you just don't get, as you inhale, the diaphragm flattens out. When you exhale, the diaphragm domes. But when you're pulling the tongue, you're keeping the diaphragm in a flattened state, so you can't exhale with a tongue pulled out. You cannot have a good exhale. So it's
Well, and
kind of
isn't it with that the kind of electric, in quotes, electrically charge of the tongue even before the respiratory diaphragm? And isn't it true that as we inhale, the tongue has a slight adjustment forward, and as we exhale, it comes back? And so
yeah,
that, in along with exactly what you're saying, that if we're protruding and holding that tongue out in that inhale, in a forced inhaled state of the tongue, it can't come back and do the natural retraction that happens on exhalation.
it's somewhat traumatized, and I could see it being injured, and it um yeah, not a good idea. If you really walk down the science, I don't see any science that would show that that's a good thing.
Hmm. Well, I
But
appreciate you
not
have.
just in your world, my world, we're guilty of the same thing. Right now, we think that, people that there are people that really need jaw expansion to open up this box, so that their tongue can exist in it properly because they're born and ended up developing very narrow palates and narrow jaws or had teeth pulled. And so one of the things that we do in dentistry is we do expansion,
Mhm.
and the parameters expansion right now is still, to me, is still unclear, really unclear. And what happens is people say, oh, I have sleep apnea, let me go expand and bring everything forward. The problem is if they bring forward, they don't look at tongue function, and the tongue, you even if you have a big jaw and the tongue doesn't go up properly, you're going to end up, remember what I said, the neck chases the face. And so if you have a face out here and the tongue's still back here, the neck's going to come with it because it's got to be able to get the tongue's going to come out to try and clear and get airway. But the straighter the neck, the less the airway. So it's like you create this catch-22 situation where the effort to open the airway, which is you in your world, they pull the tongue. In my world, they advance the entire jaw. In effort to do that, you actually lose airway. So there's a fine dance, and I don't see it as a right or wrong. I see it that we need to understand the biomechanics of the system and have some parameters so that we can make smart decisions in saying how much do we do this and how much does this human need, because everybo's different, you know?
Yeah. And I love that you went back, because that was the other thing that I wanted to touch on, of going back to the degrees and how much compression there can be in the airway. Because another common cue among physiotherapists, and this is when a client of mine will say, can you please talk to my physical therapist, because you all aren't saying the same thing to me here. And that is, it's a very common cue to lengthen through the neck and do chin tucks on somebody that is already having a flattening of that cervical spine and a compression of that airway. And as I'm having them try to open their airway and do a little towel roll and breathe and ground, and they'll saying, this is very helpful. But I'm not sure how it relates to what I'm doing in my physical therapy world, because they're having me do the opposite. It's a challenge. So I so appreciate you coming on and talking about that as an airway expert, and the challenge of, if we're already in losing our cervical lordosis and someone's already in an extension pattern, and we're throwing them further into a flat neck and a compression of the airway,
If you have a flattened airway and you do a chin tuck, all you're doing is this. You're closing that airway even more. What you want to do is to help get the lordotic curve so that this airway can open. And the best way to get a lordotic curve is to work with the diaphragm, with the hips, with the lower rib cage. By getting the diaphragm tucked in, you just increase your lordotic curve. She's at the balls of her feet and she's holding her center of gravity here. She has to arch her back. When she arches her back to maintain the lordotic curve, you'd have to walk around looking up, up in the sky. But you're not going to do that. So you're going to adjust yourself, and you put yourself in straight neck posture. So all pregnant women have straight necks. It's the reason why they have shallow breaths. It's the reason why they're klutzy. A part of the reason why they're klutzy, because they're on the balls of their feet and their lower back hurts because their center of gravity changes. But they have a reason. They're holding a baby. So if you're not holding a baby, why would you be doing that? Because now you just put yourself into these shallow breaths. And so these neck muscles, when your rib cage is fully open in an extension in the front, and you see that a lot, right, in Broadway, where they stand up there and
that rib flare, sternum lifted,
right,
flat neck.
So rather than true expansion, what they're having to do is they're having to use their neck to lift this rib cage, but in the effort to turn the neck muscles to your first and second and your clavicle to lift this rib cage, you just pulled your neck forward and you just closed your airway. So really, you didn't get more air in that breath. Does that make sense? So
oh my gosh, yeah, you're speaking my language.
So anyway, so if they could flex and learn how to expand that rib cage front and back, Okay, so you got a rib cage up front. You can actually breathe and expand that back rib cage. We call that the posterior mediastinum. You're going to find that you can exhale and really belt and do really, really well if your body is stacked well to be effective at inspiration and expiration. And that starts at the diaphragm. And I'm not
Mm-hmm.
talking about belly breathing because the
Mm-hmm.
lungs are not in the belly. Okay,
Yeah.
the diaphragm is under the rib cage and the lungs up here. If you want to expand and contract, it is it's under the rib cage that you're going to need to do that. The belly, people think it's the belly, and the reason they think that because they really didn't understand how systemic airflow occurs, which is behind the rib cage. So many people are in extension where they've opened up their anterior rib cage. And so the only thing you can do is either you lift this rib cage vertically upward, or you try to pull the rib cage downward by belly breathing in order to extend more air. But what you don't realize is, you have precious air that's available if you just flex and expand this way, you know?
Mm-hmm. I'm looking at the clock because I know we have a hard stop coming up soon. But we've mentioned the diaphragms of the mylohyoid diaphragm or mandibular diaphragm, the respiratory diaphragm, the pelvic diaphragm. I run through 7 different ones of a cranial diaphragm, the diaphragm maculae and tentorium right there at the sphenoid and the palate, the
Yeah.
diaphragm. But either way, we're talking about these diaphragm connections throughout our central line and then being able to ground down to our feet. So I was blown away when I learned from you that as I'm working, shifting from one side to the other and being able to have the ability to compress those diaphragms together on one side and then together on the other side, that my teeth came into occlusion
Yes.
with that.
Yes.
That diaphragm, that is part of what is happening as we are able to shift through gait side to side. If we are able to occupy that side, meaning get in, get out, get in, stay, and get out of, and not get stuck in. And so, can you just chat us through a little bit of what I'm kind of briefly coming into of how the teeth come together with our down the chain with that connection of the relationship of those diaphragms and then what we mean by grounding.
Well, grounding is needed for compression from bottom all the way up. Okay. And the teeth provides one of the, there's ladders of grounding, right? Or layers of grounding. So the teeth provides grounding, and there's neurological responses that connect the teeth to the diaphragm, to the pelvic floor, to the feet. And so when you lose the ability, when you lose a tooth, or when you get, some dental work done, or when you get, orthodontic movement of teeth, your body is going to experience the world differently, because when it can't find grounding, it's not like you can't exist. You still can go from A to B to from point A to point B, but you'll end up recruiting accessory muscles that you didn't mean to recruit. And whenever you use accessory muscles, there will be more effort. And not just that is from a skeletal muscle standpoint. From a central nervous system standpoint, that central nervous system is saying, I got to recruit more help because my main team is not in line to do the work that I needed to work, and my human is in trouble. And so guess what? Your sympathetic nervous system goes up, your anxiety goes up, and it goes up at a low level. But when you're talking about it going up on a low level every single day, when you're moving from place to place, when you're sleeping, when you're breathing, and you add up the days, the months, the years, now you've just completely destroyed your central nervous system, and you put yourself in anxiety where sometimes I have patients in this mold that where the very little bit of challenge in their day throws them off because they can't handle challenges because their body is in fight or flight mode.
Mhm.
I think, as I speak to everybody on this in this interview, I think everybody can relate to that. If you've lived long enough, you can relate to it because everybody's had stressors,
Mhm.
and it's one thing when you have stressors when your body's stacked well, and stacked includes the teeth, but when it's not, then your body has to work extra hard. And you add that over time, you're literally just destroying your ability to exist and have a meaningful quality life.
Mhm.
But we have tests all the time where we do dynamic tests to see, we have performance tests in our group between me and my PTs where we actually go in and test compression of teeth and left compression, right compression, back compression, front compression, how teeth come together. And by changing different parts based on somebody's body that's off, we can actually realign them using teeth, which is why I make an appliance called a PADA. It's PADA, stands for Pattern Altering Dental Appliance. So rather than compressing teeth, we basically, in order, as you're working through a process to unravel your body from it being unstacked or not stacked well, um, I'll put different compressions on something that looks like a bite guard, but it's made totally for the sake of the body. And by putting teeth compression on certain parts of this appliance, your body can sense that compression in the rib cage, in the glutes, down to the feet, the heels of the feet, and the body can find a side as it moves through point A to point B. And the cool thing is, it's not an appliance that you have to wear all the time. It's about creating body connections that your body can remember. That's how I'm supposed to function. And then our
Mhm.
training in our office includes like a dental device that helps the body to find its way, then train the body to exist in this new way, and then removing things so that the body can do its job.
Yeah.
It's kind of like learning how to play the piano. Initially, you learn the right hand, then you learn the left hand, and you got to read your notes, and then eventually you learn both hands together. And if you practice enough, you can just play and sing, you know? The body is just so smart, and especially when it comes to the autonomic nervous system, the central nervous system, breathing and all that, it is needed for existence. So the body is very smart. When you give it what it needs, it takes over and you don't have to constantly think for about it and work for it.
Yeah, I mean,
So
how incredible. And I hope the listeners really can um can just have so much appreciation for this is that Dr. Lamb is a dentist and knows so much about the body because of a collaboration of a team of practitioners all working together and has learned so much about the body and cares about what is happening under the mouth. And so I mean, if we can all just tell our dentists, please, dentists, come and take some of AIA classes, Applied Integration Academy classes, because we need more dentists in our world, especially the world of voice, where we're working with airway. We're trying to keep our airways as optimal as possible for as long as possible so we can have the career as long as we want it. But there is a body underneath it. And we want our dental practitioners to, like Dr. Lamb, be able to recognize that it is a whole system. So I so appreciate that you are doing the work that you're doing, that you are doing the collaboration and the collaborative learning and the collaborative treatment that you are doing. And I learn so much from you. And I'm really excited and thrilled to be on this journey of continuing to learn from you and just grow and see what we can do with what we find out in collaborative work and efforts.
the things that I do may seem complicated. So I thought that maybe at the end I could leave you with a few pearls.
Yeah,
And maybe
please.
some of your listeners might find helpful that are simple pearls that you don't have to understand a lot of science. Maybe you understood some things that we're trying to convey. But what I want everyone to know is that this cranium, you got 22 bones in this cranium, it needs to move. It needs to move with rhythm, and the voice world knows how to get it to move with rhythm. But if you do things, dentally, or you got to consider that it's going to change your world. For example, if you put somebody in braces or a bridge or something that connects between the left and the right hemisphere on the upper arch, because the upper arch has several bones that goes into the upper arch. Your lower jaw is just one bone. But the upper arch, if you come out of braces and a dentist puts a permanent retainer wire between your two front teeth, that could completely diminish your ability to pull air and to be able to get your vocal cords to perform the way that you optimally, because you guys are like the Olympic champions of vocal cords, right? So why would I tie your hands or tie your feet when you need to get it moving? And if somebody ties between the left and the right hemisphere, that is like tying somebody's legs together when they're trying to ski down a slope.
Mm.
So if you want control of that vocal cords, make sure you take care of your cranium, make sure it's moving and it's doing well. Don't if you have to go through braces or do anything that connects the left and the right hemisphere, just know that you're at a disadvantage for that moment in time. But do not get anything permanent that connects between the left and the right hemisphere, because that's going to change the way you're able to manipulate and use and perform with your vocal cords. Okay. So I don't know if that helps, but I'm hoping it'll help some people. It's the strangest thing
I
to
feel
get
like a
one.
lot of people will be taking retainers out and throwing them away right now.
Well, I mean, you'll find out because we do tests all the time. Your sternum will feel different. Your ability to pull in breath will feel different if you don't. I'm talking about the permanent retainer. Sometimes dentists will put a permanent retainer between the two front teeth on the upper. The lower one's not too bad. What I don't like about a permanent lower retainer is that the tongue will find it. And then instead of being at
Mhm.
the roof of the mouth, the tongue will stay at the bottom of the mouth, which will put you in extension and then change your ability to reconcile air in a way that singers really want, for them to perform optimally. So that's one pearl. The other pearl that I have for you, and it's kind of a fun pearl to think about, is, and hopefully this will lead you into you perhaps going into vision. And then once you go and take the body and the sight that we have coming up, you're going to have Dr. Heidi Wise in here, and she'll tell you. But I'm going to steal some things I learned from her a little bit to share with you. Is before you go out to sing, if you're on your phone and you're reading, or even on a sheet of paper and you're reading something, and you're completely concentrated on focal vision and you don't have peripheral vision, you've just robbed your ability to get maximum air and to control your airflow properly. Because when you lose peripheral vision, your body will go into fight or flight because it needs to protect you, because it's saying she or he is in danger.
Mhm.
So perhaps before coming out the stage, stand somewhere where you can look out and around, and even take your fingers and do this, and just play with your peripheral vision and notice your left, notice your right. But that's because that is going to open up and allow your body to feel safe and allow you to be able to, you know, maximize your ability to perform at your best.
Yeah. Oh, such
Fun
great
pearls,
pearls.
fun little
Yes.
pearls.
I love them. I appreciate the additional pearls and everything coming on and being able to be another voice of support for things that I've said for many years. And it's just amazing to me to have, uh, again, as I mentioned, had an expert on the airway be able to come in and confirm a lot of the things that I've been saying. So it's just been, I'm so, so grateful to have had this time together. Thank you so much for taking this time to come on and to talk with me and to just help with now the main thing that I would just want to say is there any way, what are the best ways for people to know about you and your work, to follow you, to, I know you're incredibly busy, so I don't know that if you're even accepting clients, but how could they get in touch with you or your team or find out more about who they could go to that has been trained similarly to you, where they will take a look at the body.
Well, Christine, we kind of are the trailblazers in this
I
work right
know.
now. Okay, I'm grateful that you even exist for the voice world. They're extremely blessed to have you because what you're doing is you're bringing science, the knowledge of biomechanics of science that it has not existed before for the voice world. And you're bringing the worlds together and you're making it a healthier place for everybody. Okay. And so I appreciate you for that because my children love to sing and they're little theater kids. And, I try to do the things that I do. But all of a sudden, I told them about you, and they've been watching the stuff on your Instagram, and they came back, and now they actually think mommy knows what she's saying, because I tried. Um, but in in my world right now, this is somewhat new. We're on the frontier of this, guys, and I'm sorry that there's not more available, but we are available in Houston to help people. We are training people across the country and even in Europe right now to do what we're doing here, because there are a lot of hurting people hurting. I'm not
Mhm.
talking about your singers that are able to out there and they're completely talented and they're young and they're doing great, fine. But if you don't take care of the gift that you have by understanding your body properly, that gift is not going to go very far. You can
Mhm.
train an athlete and have them do all the wrong things or all the crazy things to their body, and they'll go out and they'll do great. But are they going to 5 years from now or 10 years from now or 20 years from now? And who's going to come to their rescue when that happens?
Mhm.
So preventive care for your body to take care of the gift that you have right now is so important. And so that's why after I figured out that I had no idea I owned the control board, okay, I thought it was doing teeth. But now that I know I can't, it is a responsibility that weighed so heavily on me that I left my cosmetic restorative practice and now I'm doing this full time. And together with the Applied Integration Academy, we're getting this information out. We're writing a book right now, and we're hoping to get it published so that more people will know about this work. And we're teaching. That's how we found you. Got connected with you. Um, our website is appliedintegrationacademy.com, and we I'm on Instagram. We also have Applied Integration Academy on Instagram. We're getting better at posting this year because last few years we've been diving into the development of this work. But
Mhm.
now that we have it developed, and you know what happens with development, as soon as you develop some groundbreaking work, you discover more things. So you'll
Yes.
find a lot of updates also on our website, on Instagram. We're gonna definitely get more. We have so we've I just feel so blessed because I think what we're doing is speaking to people because truly medicine has failed us. Conventional medicine has completely failed us. And so because of that, every normal person that's out there, just everybody living their life, they feel the need to come out and advocate for themselves, look for their own information, right?
Mhm.
And so they're educating themselves, and the public, thank goodness we have the internet because they can educate themselves and we can put ourselves out there. And so we will have hopefully do podcasts and get the information out. Our clinic in Houston right now, so far, we've trained several clinics that are really good in the East Coast and West Coast, and we're going to have more clinics like that. But we do serve, we do have a good team of people across the country that can help others. The
Yeah. And I
courses
think
we
you all mentioned of like creating some kind of list at some point of practitioners who have been trained
yes,
by
yes,
you, and then people would be able to find them.
this,
So
this is
I think that's
coming this year.
coming.
Yeah, it's coming this year. So our website's going to show you a lot of that, who's available with what expertise, and that's going to be on our website as well. So hopefully, and you're going to be you're kind of a big deal to us, because you represent the the bridge You are the bridge between science and application.
Mhm.
Okay. The science and the application in the voice world, which is a huge world. And when I hear you speak and all these nomenclature that you have, I'm like, wow, you dive deep into, and I know all of your um, voice experts, dive deep into this because it's important to them. And I'm grateful that you're bringing science, and whole body approach to something as little as a voice box. Is not little.
Mhm.
It's a pretty big deal right here because your voice box, guess what? Is the bridge between the brain and the body. So can you
Yes.
imagine? It's the bridge. I mean, yeah.
Oh, thank you so much. Yeah, I'm thrilled to collaborate, and I'm I'm just honored and thrilled that you joined me today. And thank you so much, and thank you to everyone for hanging out and listening. And we appreciate you being here. And we'll see you next time.
Thank you.
Thank you all for listening. If you enjoyed this podcast, tell your colleagues, students, and friends. Subscribe, rate, and please write a review. You can find us on Instagram or Facebook, and feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on the Visceral Voice.